Welcome to a short video on Maryland Telehealth Grants. Maryland has released some grants to respond to the COVID-19 situation that benefit Maryland physicians. So this video short is intended to give you a quick overview and let you know how you can access these opportunities. So who's doing this? MedChi, the Maryland State Medical Society. We're the 7th oldest medical society in America. We're the foremost advocate for physicians, patients, and the public health of Maryland. And I'm Gene Ransom, the current CEO. So there are two telehealth grants that you should be aware of. The Maryland Healthcare Commission announced on Friday, April 24th, a new telehealth grant program, which allows state-designated managed service organizations to provide free consulting services, and in the physician practice can receive $500. There are no restrictions on the type of physician practice that can apply. The only eligibility requirement for this one is that the practice is not yet built for telehealth. It's a really good opportunity for the practice that maybe is just starting, hasn't quite figured it out, or really thinks they need to figure out how they can provide telehealth services given this COVID situation, and they can keep their practice open or at least see some patients and do follow-up and things like that. If you're interested in doing this, MedChi is willing to help you out, regardless of whether you're a member of MedChi, the Maryland State Medical Society, or not. You can reach out to Andrea Mullen, and we're more than happy to help you apply for this grant. The second opportunity is for doctors who are interested in the Backline Doctor First product. Doctor First Backline product is a telehealth handheld product that you download on your phone or your iPad or your Android. The product allows you in a HIPAA compliant way to provide telehealth services. It's a very popular product in Maryland. Over 200 practices are using it from what we understand. Anyone who purchased the Backline product after March 1st in response to the COVID situation and before December 31st of 2020 is eligible to receive a $300 grant. It's very easy. You can go to the MedChi webpage at www.medchi.org and fill out the simple one-page application, and each license is eligible, each physician. So unlike the Maryland Healthcare Commission grant, which is by practice, this grant is by licensed physician who has the product is eligible for the grant. If you have questions, you can reach out to Andrea Mullen at MedChi, or you can shoot her an email, and she's more than happy to help you apply for this and the Maryland Healthcare Commission grant opportunity. Another thing that has been offered or is offered to all Maryland physicians is Dr. First iPrescribe tool. MedChi has negotiated an arrangement with Dr. First where iPrescribe is free for Maryland physicians, and this handheld tool allows physicians to simply send an electronic script at no charge through their phone. Again, this product can be downloaded on Android and or iPhones, no problem. One of the really great features is that Dr. First is connected with CRISP and the PDMP. So not only can you send an e-script, you can use this handheld app device on your phone to check the PDMP, which is a really valuable and easy thing to do. If you're not at your normal office with your EMR or with access to your full computer, it really allows you to make sure that you're making good choices. And again, as a result of a negotiated arrangement with MedChi, the Maryland State Medical Society, and Dr. First, this product, which allows you to help practice telemedicine, is free for Maryland physicians for 1 year. And then after that, it's a very reasonable rate, but you can cancel if you'd like. So that's another opportunity. So there are really three opportunities in closing here. You've got the Maryland Healthcare Commission grant, which allows you to get consulting services and $500 for the practice if you institute telehealth. The Care First MedChi grant to purchase the Dr. First Backline telehealth product for 1 year, where they will send you $300 to cover the cost of a license for 1 year. And if you've already purchased it, then you should definitely reach out and get your check. And the third is the free iPrescribe electronic prescribing tool that you can download and add as a tool that you can use so you can practice telemedicine effectively. MedChi will continue to be your advocate and your resource during these trying times, but in all times, as we have since the beginning of our organization in 1799. Thank you for taking a moment to hear about these exciting opportunities.